I'm Dr. Kimberly Hubenette, and thank you for joining our special webcast tonight. I am an anti-aging dentist in Sonoma, California, and tonight we have a special guest, Cardiac Nurse Practitioner, that is sharing applications of a very new science. And my colleague Ann and I will be talking to her. So many of you know my passion is whole body dentistry and whole body health as it pertains to oral systemic link. And whatever you put in your mouth affects the rest of your body. We know that inflammation is associated with many disease processes and significantly in periodontal disease, diabetes, stroke, cardiovascular, brain function, autoimmune disease orders. And as free radicals accumulate, causing oxidative stress cellularly, symptoms occur. Although oxidative stress is not a disease process, it is associated with many disease processes. Now, I've been a dentist for over 25 years, and I've been married for about 15 to my husband, Mark. We live in Sonoma, California, and I've always been interested in whole body health and genetics. Most of my family have had health issues such as diabetes and heart disease and high cholesterol all their lives. And to avoid these genetic heritage, I work out weekly. I eat healthy and I do everything in my power to be healthy. But, you know, I know that I can't beat genetics, or can I? Because I own my own dental practice, I too have to earn, money and live. And I also trade time for dollars, and in my traditional dental business. And if I'm not working, I don't get paid. So I struggle to keep my life balance, working, spending as much time as I can with my family and my husband. And time is treasured in my life and my household, like I'm sure is with yours. I found a way to be healthy, stay healthy, grow old gracefully, and give myself more time with my husband. In 2011, when I got introduced to what we're going to share with you tonight, on how we can control our genetics better, we have had amazing scientific discoveries now that you should be aware of, so that you can make your own decision. Today, you will be hearing terms that you may never have heard before. One being nutrigenomics, nutrition that can affect your gene expression, and biohacking. In this sense, hacking is not a bad thing. Hacking is a great thing. Biohacking is simply the process of optimizing your health by taking control of a complex system for a desired result. One of our partners stated it clearly: if you are ever counting calories, you're a biohacker. If you look at labels at the grocery store and concerned about ingredients, you are a biohacker. So, we are all concerned about what we look like, how we feel to a certain degree. I know I am, I'm sure you are too, and some more than others, but all have a certain degree of interest. My mission tonight is to educate as many people as I can about reduction of oxidative stress with the most efficient natural activators. I hope you learned something new tonight and share with your friends and family and incorporate efficient health into your life and business. With that being said, I now want to introduce my special guest tonight, who is in the forefront, working in the trenches daily, a health advocate, and a fellow biohacker. Let's welcome Sandra Kreul. She is a nurse practitioner, advanced practice Nurse Practitioner, currently working in a private cardiology office with Dr. Benedict Maniscalco. She is a fellow of the American Heart Association, fellow of the National Lipid Association, and has served over 2 terms as a chair for the Department Committee for the AHA Council on Cardiovascular Nursing. She's also chair for the Strategic Development Committee and on the board of directors for Heartbeat International and Southeast Lipid Association. Whoa, that was a mouthful. But thank you so much for being on our call tonight. And I understand that you've been with the cardiology area for over 21 years, right, Sandra?
Yes, actually, I wanted to say thank you for having me on the call tonight. It's very exciting. It was super awesome to talk to you last week. So I appreciate you reaching out and inviting me on the call. Yeah, so I've been doing cardiology now since I moved to Tampa in 1997. And just before that, I'd worked 5 years at the Cleveland Clinic. So I came from a good background, and then I've now been doing cardiology since then.
Well, welcome.
Thank you.
So can you tell us a little bit about your story first and how you got involved with cardiology?
In cardiology itself, I've always, for 4.5 years, when I had left my hometown of Rockford, Illinois, I had become a traveling nurse, and that was back in 1987.
Mm-hmm.
And so in 1987, I decided that I wanted to travel, see the world, meet new people, work in different places, and I'm that free little spirit, and away I went. And so I did that for 4.5 years, and I actually loved it so much that I made myself stop, because otherwise I would still be doing it. And I got my bachelor's degree, then my master's degree in my nurse practitioner, and ended up moving over to Tampa, Florida in 87. And I've been working with Dr. Maniscalco ever since. And he's a world-renowned eminent cardiologist who has done a lot of things in medicine that are history-breaking. And so we just kind of meshed really well together. He allows me autonomy, and it's just has been a great practice relationship, really has been. And I've been there for now 21 going on 22 years, so it's hard to believe.
So, but as a cardiology, nurse, how is it that you guys are so innovative? Because it's very hard for the normal cardiology or medical physician to really be open to natural whole body types of supplements and so forth. And actually, how is it that he's so open and you're so open to this? What have you seen?
It really kind of starts with being a very both of us kind of like feed off of each other and teach each other and encourage each other and that kind of thing. So it's a very nurturing relationship and in a professional manner. And so I actually opened up the very first advanced lipid clinic in the United States, and it was part of the Berkeley Heart Lab. And so I have known about measuring inflammatory markers since 1997, before it really got in vogue. Mm-hmm. And so I've known about it for a long time. And so when I started to read the science, and Dr. Maniscalco has always been open to reading about the science and really dissecting things. And his philosophy is, the day you stop learning is the day you die. And so, and I believe in that too. And so the day you stop learning, shame on you, because there's so much to learn in this world. It's like every single day and every second, the entire world is discovering something. It's not just here in the US, it's the entire world. And so if we're not open to learning and exploring, then how are we ever going to grow as humans? And so we've been able to, with this advanced testing, be able to test these inflammatory markers. And it's straight, simple forward blood test. It's nothing that spectacular, and insurance companies cover it. And so we've been testing it now since 1997 when I got there. And so he started to see, because I tested, and he would look at the lab results, because some patients would want to come back and follow up with him, or some would follow up with me. Then he would start to look at these laboratory results, and he would come to me. He would ask me, what is this? And so then we were able to correlate all of these inflammatory markers that we've been measuring now for a long time, and then see with the research that has been done with Protandim and Nrf2, you know, we've been able to finally tie the story together. But also he went to school, you know, with the scientist, with the doctor who taught, one of the discoverers, Joe McCord, this is a tight circle. So there's, the scientist that Dr. Maniscalco was taught by, who taught Dr. Joe McCord, and then now here Dr. Joe McCord is part of this company. And so it's a tight circle, and so when we finally were able to get a hold of this information, it was pretty easy to, make that circle complete.
How do you when you talk to patients, how do you tell them what the difference is between Nrf2, Nrf1 activation pathways and the regular supplements that they normally take?
Okay, so I'm going to go at it exactly how you said. So Nrf2, I explained to them that there's a pathway that's in each cell in our body, that's when it's activated, okay, that it makes its own antioxidants. We make our own antioxidants until we're about the age of 20 or 25. It's at that point that that pathway can no longer keep up with the level of oxidative stress that's occurring in the body. Growing and expanding and all of these, cell expansion and everything until that time is so explosive that the body is revved up and ready to go. Every single day we live, eat, and breathe, we are producing free radicals that lead to oxidative stress, okay? And so that pathway in the cell was actually designed to fight the aging process. But we have pollution and impurities in our food and everything else, and stress because we all work crazy hours and everything else, then the body can't keep up. So what this product does is that it activates that pathway and activates your body so you produce your own antioxidants at a ratio of 1,000,000 to 1 per second. Vastly different than taking a supplement. If you take a supplement, you're trying to activate at a ratio of 1 to 1. It doesn't do the body very much good. Would you rather activate at a ratio of 1,000,000 to 1 per second or at a ratio of 1 to 1? And that's the other thing. We teach our patients that unless you are deficient in something, you don't take a supplement to what are you supplementing? If you're not deficient in it, then you don't need to supplement it. You know what I mean? Like, you don't do that. You just don't do that. And so we taught our patients really well. Our patients are so well educated. They go to their doctors and they're like, I don't need that. I want this. Okay. And they educate the doctors out there. And I think that's our job as, healthcare providers, is to educate, the Nrf1, okay, called Nrf1, what it does in the cell, in every single cell, there's a little powerhouse. I call it the supercharged generator. And the supercharged generator, what it does is it gives the energy to the cell so that it can produce the energy, right? Okay, like we had Hurricane Irma down here. Not a good scene. Was not a good storm down here. The entire state of Florida was impacted, okay? For those people who had generators, no harm, no foul. They carried on in their life. Well, those people who did not have generators and they lost everything in their refrigerator, everything in their freezer, everything, okay, And they sat there for 2, 3, 4, 6 weeks without any air conditioning because there's no generator. How happy do you think they were? They were not very happy. They had no energy, okay? So when you activate that Nrf2 pathway, what it is it activates the mitochondria, which is the powerhouse of the cell, to not only make more energy, but to go to the repair shop, we'll say, and repair themselves, okay, so that they can go out the next day or the next millisecond and do what they're supposed to do, which is give energy to the cell. So that's how I explain it to the patients, because everybody down here understands Hurricane Irma, because everybody in the entire state of Florida was impacted. And so they can relate that and they can understand that, you know? Right. So that's how I explain it.
So when we talked last time, you talked to me, can you tell me a little bit about how you explain to a person how do they benefit in regards to their cholesterol levels? And what do you, especially to those patients and customers who ask you about what they should be feeling?
Well, that's a really great question. And I get it every single day, all day long. And it's like in the beginning, because I mean, I've been doing this now with LifeVantage for 5 years. And it was hard in the beginning, but I go back to my own way that I felt when I started this product. The one thing that I noticed immediately first off, and I don't know, and I'll ask you girls what you felt as well, okay? I felt amazing energy, and this is just with Nrf2, because when I started this, we did not have Nrf1. So I felt amazing energy, and I slept better than I've slept in so long. And so I remember that because I was like, I wonder if this is just a hoax. Is this just by serendipity? Or is this really the protandim really doing it? Okay. And, you know, so I explained to the patients about the inflammatory, you know, cascade, how as long as we are living, eating, and breathing, we are producing free radicals. Free radicals cause inflammation. And inflammation, that process alone, causes and starts every single disease process that is known to mankind. Every single disease, periodontal disease, cavities, arthritis, headaches, cholesterol, high blood pressure, everything you can imagine. Okay, so when you interrupt that pathway and you decrease the inflammation by making your own antioxidants, you're actually decreasing your cellular aging, and this is proven now, 40% in 30 days with Protandim. There's no other product out there that does that. So I explain to my patients, it's not necessarily something that you could feel, because unless you have a lot of inflammation, like my ladies with fibromyalgia, or my colitis patients, or my, you know, diverticulitis, or you know, those kinds of patients with a lot of inflammation, lupus, multiple sclerosis, okay? It's those patients who have got so much inflammation that they truly feel a difference. Now, with that caveat being said, with those patients with a lot of inflammation, they are going to get most likely some side effects from this therapy. And what are the side effects? When you activate the Nrf2 pathway, this product, even though it's all natural, is so powerful that they can get what is called a detoxification. Because when you activate that pathway, it also activates the detox gene. And so it rids your body of all the toxins that are in the body. And the way that that leaves the body is usually through lower GI upset. And so I tell my patients, you got to hang strong, drink lots of fluids, go down to just clear liquids, you know, maybe some, you know, like some soup, bouillon, things like that, okay? But don't have any real food for a couple of days, okay? Just take broths and things like that, and it will all start to calm down, because no matter what, you've got to detoxify. And all of us need to detoxify, you know, and so Dr. Maniscalco tells his story very frequently, and he had such a highly allergic state that he started and stopped Protandim 4 times before I finally looked at him, okay, and told him, I said, it's time for you to put the big boy panties on and rock through this, because you've activated your detox gene and you need to get through this. And at the end of 2 weeks, they've gotten through it, okay? And he's been taking it every day since then without fail, okay? I got a little bit of lower GI upset, but nothing like what he did. You know, so this is a product that really, really works. And as long as we are living, eating, and breathing, this is a product that you need to have. Because the Nrf2 pathway, unless you're a professional athlete, is not easy to activate. Okay, it's activated by dark chocolate by small amounts, blueberries, by exercise. So it's very interesting too, because those people, if they exercise too much, they actually, instead of just activating the Nrf2 pathway, they cause an increased amount of free radicals and oxidative stress and cellular damage. So it's a very fine balance. It really is. So I know that's, again, long answer to, but it's like none of these questions are very easy. You put me to the test tonight.
Well, you know, we have doctors and hygienists and dentists on the call too. So I also wanted to ask you about the blood panels that you do take to measure the inflammatory processes. Like, what, you know, how many? You were telling me that it's a significant difference from other cardiology offices in your area. That you can.
Yeah, so there's an inflammatory panel. I don't know if I was prepared. I mean, it's not like I wasn't prepared, but I could try to pull up the inflammatory panel of what we order. Okay, I don't know how I can do that. I've never done that before.
But you can see
so anyway, so it's a whole entire. The latest company that we've been using is Cleveland Heart Lab, and the Cleveland Heart Lab. Just now is bought up by Quest. So all of the proprietary intellectual properties, okay, that Cleveland Heart Lab has is now property of Quest Diagnostics. Now, Quest Diagnostics is all over the United States. And you can actually go on and you can request the inflammatory panel on Quest. Okay, now there are other companies that do this as well. There's SpectraCell, Boston Heart. There's a whole bunch of companies who do it. Okay, but it looks at Nrf2, not look at Nrf2. It looks at F2 isoprostanes and myeloperoxidase. These are just different chemical cascades that occur in the inflammatory process. And so what we've done in the beginning, because I was kind of like, well, it's one thing to have it in a clinical trial. I want to see it in real life. And so what we did is we took 100 patients and we measured their inflammatory markers before, put them on Protandim. 8 weeks later, we tested their blood inflammatory markers again, and everybody improved. All 100 patients. Okay, and this is one Nrf2 Protandim every single day. Wow. And so we proved to ourselves, okay, that this is not just in clinical trial, but this is in real life medicine with real people.
That's right.
You know, yeah. And so I'm a see it to believe it girl. You can't take the nurse out of a nurse. I got to see it. Let me see it. I know you're telling me. I got to see it. So
what about in the business standpoint when you introduce? Have you seen increased revenues from?
I've seen increased revenues because we, of course, we encourage our patients to take it. Okay. There's, to me and Dr. Maniscalco, an ethical line that we do not cross in our practice to encourage patients to join the practice. I have had only a handful, not even a handful. I mean, as in one handful, as in 5 people, inquire about joining the business. I have created my downline because of just my personal relationships or, you know, referrals from other people, things like that. So that is a continuum, you know, and so patients will tell other patients, or patients will tell other friends, hey, have you started da 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 da? And so that kind of helps perpetuate it as well.
Wonderful. And
but we've also got, I'm sorry to interrupt, but we also have posters about Protandim in our office, and we have a video education series that it runs in our practice in the patient exam rooms. And we have uploaded our own videos about Protandim. So patients, as they sit there, can listen to Dr. Joe McCord talk about the Nrf2 pathway and inflammation and all that. And so it's a continual education process.
Perfect. We have about 8 or 10 minutes left, so I wanted to thank you for being on the call, and we really appreciate you talking about the science and the benefits in people's lifestyle, because really it's all about our patients and our healthy lifestyles, right?
It absolutely is, absolutely. From start to finish, and you don't ever stop, because that's what we're in this for.
That's right.